Hi, welcome to our presentation on our health experiences.
Hi everyone, my name is Catherine. I have several different jobs. I work as an inclusion advisor for the DSA. I also work at H&M Clothes Shop. I love working with a team of people. The DSA and H&M are perfect jobs for me. I am excited to make a change, stand up and advocate for all people who have learning disabilities. I am currently working on a dance leadership program. I joined the DSA's self-advocacy group called Our Voice in 2020. I started my paid role as an inclusion advisor in July 2023.
Hi, I'm Joe. I love performing and the creative arts. I think it is so important to represent and advocate for empowering different communities. Women's equality, nature and wildlife are also my inspirations. I love having an open mind and I am excited to use this to make a positive difference in my role as an inclusion advisor. I started my job in July 2023. I was a student representative at college where I had an inclusive education. I have experience of work meetings through other leadership roles in my other local community group. I joined the DSA self-advocacy group called Our Voice Group in 2020.
So now we're going to talk about the history of the Down Syndrome Association. So, Dr. John Langdon Down was the doctor who first described Down syndrome. That's why his name is part of the name of the condition. He was a respected doctor who, along with his wife Mary, wanted to create better care for people with learning disabilities. Before this, he worked in Harley Street at the London Hospital and as a supervisor of the Royal Ellsworth Eltham. In 1868, John and Mary moved to a new hospital to start their own service for people with learning disabilities. The White House on the site was their family home, and they lived among the people they supported, which made a Normansfield Hospital unique for its time. Here are some photos of John, Mary, Normansfield, and the White House where they lived.
The Down Syndrome Association was founded by Rex Brinkworth. He established the Down Babies Association in 1970. The organisation's name evolved over time. Today, the DSA provides comprehensive advice, support, and resources. We are now going to talk about an experience using health services.
So now we're going to talk about our health experiences. One night, 2 years ago, I was feeling sick. I went to the GP the next day and they transferred me to A&E. I went to the hospital with my mum and I saw a nurse. Unfortunately, the nurse didn't believe me. I was ignored and told later that they didn't believe that I had a pneumonia because I wasn't presenting like others would. It was hard because they were not listening to me and didn't communicate with me. It was my first time in hospital, and I felt strange as I was also working there as a volunteer, and now I was a patient.
I didn't have any major health issues until 2022. So before then, I only ever saw my TP. In 2022, my TP referred me to neurology at Sheffield Hospital. It was my first experience of adult healthcare. The neurologist was excellent. I remember at that same time, I had lots of brain scans and had lots of questions from the student trainees. I even gave permission to be involved in their study. They spoke to me clearly, explained all the tests, and after they were completed, I was given my diagnosis. The follow-up from the consultant and later a professor was also good.
Now we're going to talk about the suggestions for health professionals. So, give clear information and guidance. Make sure people have named contacts. Allow extra time. Try to use communication that matches the person's understanding. Talk directly to me and explain clearly. Take time to check things properly. See the person, not the diagnosis.
Don't dismiss symptoms. Don't assume people understand without checking. Don't rush the appointment. Don't assume all people with Down syndrome are the same. Don't make decisions without the person or their family. And don't talk over the person.
Now we're going to talk about our final messages. When I go to the doctor, I find it difficult to explain what my problem is. Sometimes I know in my head, but I can't tell you because I can't find the words. I need time for you to understand me because like everybody else, I have individual needs. Please respect my needs to be treated and listen to me. If I could see the same doctor, he would get to know me and understand me, and I wouldn't have to repeat things that have happened. This doctor would be able to review all medical tests and reports and take a more holistic approach.
Even though I have Down syndrome, it does not completely define me, and I am an individual with my own interests, hobbies, and achievements. Good doctors listen carefully, explain things clearly, and involve us in decisions. Thank you.